Okay. Good afternoon or good morning, depending on which part of the country that you are in. Glad that everyone is here. Welcome to the NASPD webinar series. The series today, we're going to talk a little bit about healthy parks and healthy people. I'll be your host and facilitator, Phil Gaines, the retired director of South Carolina and currently a member of the faculty at Clemson University. Clemson is excited to be able to partner with NASPD to do these webinars. Got a lot of things to talk about today. We're going to try to squeeze in a lot of information that I think will be very useful for America's parks. Have three really good speakers today that's going to talk a little bit about prescription for parks and how that works. And we're going to start off with, we're going to start off with, we're having those same problems. Worked in rehearsal, right, Sandy?
Yes, we did.
So I keep saying it. There we go. Okay, so we're going to start off with the kind of the prescription for parks things that I know NASPD folks heard a couple of years ago at our conference in Sedona, where Dr. Robert Czar talked a little bit about Park RX America and talking about the virtues of prescribing nature during the routine delivery of healthcare by healthcare professionals. And we're going to take that a little bit further and look at what some of the research has been done and what some of the research is doing and talk about some things that are actually going on in Washington State Park System. And so Dr. Czar, I've talked to him a couple of times in the last week. He apologized that he could not be here. He's in Japan today, and we were unable to get him online. But he did leave us a little message, so I'm going to show a quick little video of Dr. Czar and his comments about the program. And it's only about a little over a minute and 50 seconds. So it's real brief, but we're going to post his additional comments online after the webinar so you can hear some more from Dr. Czar about this program. It'll get us started, and then we'll dive into some actual data. So here's Dr. Czar.
No sound here, Phil.
Meeting that was very slow. Directors.
Still not here again.
Over a year.
So,
Just a short time ago.
So we're having some audio difficulties with his video. He sent it to us from Japan. So we'll post his entire interview and his comments and a link to his website. It's got some really fascinating stories about some of the results of the RX program that he has started that talked to NASPD in Arizona a couple of years ago. So let's really do a deep dive into this and talk about how it's working in the field. And we're pleased to have Sandy Mealing with us today. And Sandy is with Washington State Parks. And Washington is represented today. I think Director Don is in the room with Sandy, so no pressure there, Sandy. I'm gonna turn it over to you for a little while, and you kind of tell the rest of the country about what Washington is doing and giving us some practical advice and applications to how the program has worked in Washington State Parks. So Sandy?
Sure, thanks, Phil. Thanks for inviting us to be here. And as you can see, I've got a few of the people here from state parks. So just to start out with, Washington State Parks launched its Park RX program back in April of 2019. To get the program launched, the first thing we had to do was get all of our parks and properties added to the database so that they would be available to healthcare providers to prescribe to their patients. We had strong support from both our director, Don Hawk, and the commission, so much so that one of our commissioners spent a great amount of time adding in not only information for state parks, but he also added information for city, county, PUD properties and parks across the state. So now we have 862 parks and properties from Washington in the system. And this makes it better for the healthcare providers because there's just more options for them to pick from throughout the state. We officially kicked off the program by participating in the nation's first National Park RX Day, with several of our parks across the nation, across the state, hosting walks, hikes, and other guided recreation opportunities for our visitors. So then we had to get busy getting healthcare providers involved in the program. Since healthcare providers are the backbone of the program, we needed to get them to join so that they could start prescribing parks. To get this, we launched a media campaign throughout the summer. We worked with the governor's office to have an article published on his website, which was also picked up by the media. And then we also worked with several other state agencies to promote the program. And we now have several other state agencies as partners, and those include the Department of Veterans Affairs, the Department of Health, the Department of Social and Health Services, Washington Department of Fish and Wildlife, as well as several cities and other civic organizations across the state. Now, since starting our outreach last year, we're now the leader in the nation with the number of healthcare providers that are part of the program, with 96 at the last count. And currently, we're working to get Madigan Medical Army Center, which is up at the Joint Base Lewis McChord, to have their healthcare providers also involved in the program. And one of our partners that just came about this, an opportunity that just recently came up with, was Department of Health, where we're going to be working with them to apply for a CDC grant to provide Discover Passes, which is the pass that is needed for day use access to Washington State parks, so that we can show the benefits of outdoor recreation for people with arthritis. And so the one thing I can't stress enough is that it's really important. I think that's made our program such a success here, and the support that we've got is because we've had the support from our leadership. Our director, Don Hawk, was instrumental in opening the doors with some of our state agencies, which has led to other opportunities, including the opportunity to apply for the CDC grant, which if we get approved for, will provide $20,000 for us to provide access to state parks. And so far, we've received a lot of positive feedback about the program, and people, especially the healthcare providers, they truly understand the importance of getting outdoors and helping to create healthy communities. So now I'll just run everybody through how to write a prescription in the ParkRx platform so you can see how easy it is. And then just for the ease of this purposes, I'm going to pretend, I know you all are not healthcare providers, but I'll just pretend you're a healthcare provider, and that's how I'll explain to write the prescription. So this is the home page that you'll see. To begin with, healthcare providers have to go to the parkrxamerica.org website to sign up for an account. Now, once they've done that, they can write prescriptions. You'll go to the same website when you're ready to write a prescription. You'll see a link at the top of the tabs, at the top of the site where it says Prescribe Parks. That's where you'll go to get this homepage. Once you've selected that tab, you'll be taken to this page with the map, and the system will automatically detect where your computer is if you allowed it to do so when you signed up for an account. Now, for our purposes, the system recognized our computer at Tumwater Boulevard in Tumwater, as you can see. And then once you've done that, if you want to leave it there, that's fine. Then you'll select, I don't know if everybody can see down at the bottom right, it might be blocked if you have the video up, but there's a link called Prescriber Login. So when you click on that, the next page will show you what the prescriber login, just your basic information. So it'll be the email that you use as well as the password when you signed up for the account. Then you just click the login slide. And then, so once you log in, now you'll be able to actually see more of the options that the website offers. Now, as a healthcare provider, you'll talk to your patient to find out, if they want to visit a park near their work or their home. And then once you know that, you can type the full address in that top line right now where it says Tumwater Boulevard. You can either type in the full address of their home or their work, or you can just type in the city, state, and zip code. And on the next line, you'll see that there's some options where you can pick the radius for how far you want the system to search. Most common is probably 5, no more than 10 miles, because you're not going to be sending people 80 miles 3 times a day to go recreate or to exercise. So for our purposes, we just went ahead and selected 5 miles from Tumwater Boulevard. You can go to the next slide. So you'll see here from the system, it returned 117 locations that are within 5 miles of our location, or 117 parks or properties within 5 miles of our location. If you want to narrow down these choices, you can select the filter result to the right of the results to choose features, amenities, and recreational opportunities that are important to your patient. Again, it's a little green box to the right of your results, and I don't know if you can see it if you have your cameras on. There you go. So on the next slide, this is the filters page that you'll see. These are all the options that the healthcare provider has to pick from. So after speaking with your patient and finding out what's important to them, you'll click on the items you want to filter for. And for our purposes, we just selected walking. And as you can see on the next slide, as you can see at the top there, it told us that it returned 29 results. So there's 29 parks and properties that meet the criteria that we filtered for. Now, if you want to narrow that down even more, you can select additional items from the list. So such as ADA accessible or trail difficulty, if you want pets allowed off leash or on leash. Just know that this system is not an and/or, it's an and system. So everything that you pick, that one property has to have all of those. So if you want to narrow it down, you pick more items. If you don't want to narrow it down, then just leave it at that one type of filter. And then once you're done selecting all the items that you want to filter for, you just click at the top right where it says apply filters. And next slide. And then you'll be taken back to the home page. And here again, you'll see at the top there where it says 29 results that are above the map. Again, that's the number of parks that meet the search criteria. And the parks are listed on the right by the park name. And as you can see, we've got it listed right now according to distance, but you can also sort by park name. Above the top there where it has the park names in the green box, you can see where you can sort the list if you want. And then on the left, it also shows you where the parks are with the red tabs or the blue circles. The red tabs mean that there's one location in that area. The blue circles or the yellow circles means there are multiple facilities, parks, or properties in that area. So for instance, the one I have highlighted there is the blue circle that has 5 properties within that vicinity. So if you want to zero down to that one, you can go to the next slide. That's the same thing, sorry about that. So you go to the next slide, you can see, so once we've clicked on that 5 circles, the number 5 circles, it zooms down and you can see all 5 of the properties that are within that vicinity. Okay, next page. So let's say you know what property you want to pick. For this purposes, we're going to pick Willapa Hill State Park because we are a state park system. And once you click on the name in that list, on the left within the map, the little red tab will show up, but also a little pop-up about the park information will show up. Next page. And you'll see 2 tabs right underneath that pop-up box where it says View Park or Directions. And if you want to click on, let's say, View Park, go ahead to the next page. This is what you'll get. It's actually a PDF of the park property that you selected, and it shows all the features, the address, the phone number, the hours, any information that has been input into the system about that park. And this is something that you can print out for your patient for them to take with them, or you can save it and email it to them as well. Next page. And then let's say they need directions. So the next option you can do is select directions, and it'll pop up a Google map. And it gives you directions from the address that you put into the system to the park that you selected. And you can either print this out, and you can even send it to your patient's cell phone. Uh-oh, next one. And so once you know what park you want to prescribe, you simply check the box to the right of the park name so that the box gets a little check mark on it. and then you select prescribe down in the bottom right-hand corner of the page. Next page. And then this is the window you get. You'll see at the top it has the name of the park that you've selected, and then you just fill in the prescription that you want. And so for our purposes, we want the patient to walk with their dog 3 times a week for 30 minutes. Next page. So now your options to get this prescription to your patient are either to send it by text, send it by email, or print it out. And so if you check either send by text or send by email, it'll look the same. The only difference will be right underneath where it says patient mobile number. If you select by text, it'll ask for the mobile number. If you want to send by email, it'll ask for the email. So, but the rest of it looks the same. And underneath that, you'll see you can actually send reminders to the patient. So you can decide to send it weekly. For our purposes, we went ahead and checked weekly for 2 months. So you can select the duration as well. And then once you've selected the options that you want, then you go ahead and hit send prescription. And now in the physician setting, this is really helpful because when you get to this window, you can actually, if you do electronic medical records, you can just click the copy RX button and go to the next window. And then hop over to your electronic medical records and then just paste the prescription right into the clinic notes or the prescription. So this makes it really easy for healthcare providers so they don't have to retype all the information. It just automatically transfers over into the electronic medical records. Next page. And so at this point, if you you didn't send it to the printer to begin with, you can also send it to the printer here so that your patients can walk away with a written prescription. And the next window, next page. This is what the prescription actually looks like if they print it out. So it has everything written out. Of course, the patient's name would be up there. We just don't have one. And then if need be, the doctor can sign it. And again, to the right, the prescription date is there if you can see it. And then the part code is there as well, the prescription code. And one of the nice things about this system is if you do have Spanish-speaking customers or patients, you'll notice all of the items are in Spanish. So then all you have to do is, of course, be able to write in Spanish, and then you can write the prescription in Spanish for them. Now let's say that you want to do a custom prescription that you just want them to, go in the backyard and, I don't know, play badminton just to get them outside. So of course we're not going to have their addresses in the system, or perhaps there's a local park that's not in the system. You can, when you're back at this main window, you can select at the top there where it says custom destination. Next window. And then you'll get basically pretty close to the same window. The only difference is instead of the park that you're prescribing to be at the top, you'll have a new box where you can actually type in the location. And then the rest of it is the same. You're going to write out the prescription, what you want them to do, how often, the duration, and then the rest of the process is the same where you just select how you want them to get their prescription. Next window. And now what does the patient see? This is what the patient will see, whether they get a text or an email. They'll click on the link and it'll take them to this window, and it actually looks the same for both ways. And one way for ParkRx to collect data is for them to actually click, yes, I visited this park. And so this way, the system, the ParkRx system, the platform can actually collect how many prescriptions were written and how many prescriptions were fulfilled. And at this window too, the patient themselves, if they want to, they can print out the prescription for themselves. And that's it. That's all there is to writing a prescription.
Sandy, thank you so much. And before we go to Jason to talk about some of the research and science, a quick question that I'm sure some other folks have too. So, and Don, feel free to jump in on this from your level as well. So how did you get doctors or physicians engaged enough that they were willing to do this? And how did that process go? Is that something that Dr. Zar's group was helpful with? Because the way that I understand this is that all that we went through, your physician would do this, correct?
Right, and it actually doesn't have to be a physician, it's any healthcare provider. So it could be a mental health therapist, a massage therapist, we're even working with veterinarians to get them signed up. And so we're doing this by the ground, you know, the hard way, the ground roots. We're reaching out directly to some healthcare providers. We're also working through some state organizations, state agencies that have direct connections to healthcare providers. And then also I think we've gotten a lot of them because we reached out through the media. A lot of the people that signed up is because they heard through either our social media or through the news releases that we've sent out or through the radio, because we also did a radio and we had a TV campaign as well.
That makes those numbers that you said earlier about how many physicians had signed up even more impressive, to know that they really have some skin in the game on this to be able to actually go on the website and fill this out. So one other quick thing, and then we'll continue on. Earlier you said there was a grant that you had $20,000 again, that $20,000 was available. Tell us a little bit about what that grant was. And I know in parks we're infamous for using acronyms that maybe not everybody understood what the acronym was. So tell us again where you got the $20,000 grant and who provided that funding source.
Right. And actually, we're just now applying for that grant. We're working with our state agency partner, the Department of Health. We're part of their arthritis group. They have a program that works with people in the country to help, you know, with their arthritis issues, help prevent it, help improve their arthritis. And so that program applies for Center of Disease Control grants. And they just got word of this new grant, and they wanted to know if we wanted to participate in it to get a grant for the ParkRx program. And so we said yes. And the way we're going to participate is hopefully by, if the grant is approved, is providing access to patients, because there is a $30 annual Discover Pass to have day use access to our parks.
So that grant funding from the Center for Disease Control would help assist in that Discover Pass, correct?
Correct.
Yeah, and that's a federal grant. That's not just Washington specific. That's for the entire country.
Correct. It's a federal grant.
Yeah. So that have applications for park systems across the nation.
Yes.
Very good. And the more research we were looking at when we decided to look at this, Washington State is doing really spectacular things to be able to impact communities. And I thought it was very interesting that you went beyond state parks, and to really make it work, you partnered with a lot of local park and recreation organizations as well. So tip of the old campaign hat to Washington State Parks for doing a really good job and sharing your successes with the rest of the country. Thanks, Sandy, for your presentation. So we've kind of seen on the professional end where physicians engage with their patients on bringing folks outside and talking about the benefits of health in nature. And now let's go to Dr. Jason Vaccaro, who's with North Carolina State University. And Jason, I will kind of turn it over to you to tell us a little bit about what the science says and what some of your research has shown about health programs in state parks.
Great, thank you very much. And I really appreciate the opportunity to jump on today. I'm going to try and keep it to 7 or 8 minutes or less, just so that we can move on to Courtney afterwards and allow for some questions that you all might have. But I do want to concur with what Phil talked about, that as we put together this action plan and toolkit that Courtney will be talking about afterwards, I got the opportunity to talk to a number of state park directors and folks across the country, and Washington State are doing some incredible stuff. So Don and your team, kudos to all of you. So this has been some work that myself and other folks at North Carolina State have been involved in for about 4 or 5 years, and it's really exciting. And so if you move to the next slide. One thing I wanted to start off with is just this CDC quote. 90% of the nation's 3.3 trillion in annual health care are for chronic and mental health related issues. And I've bolded the mental health aspect, and I'm going to revisit that because I think this is a very, very unique opportunity as we see the statistics, as we see some of the ramifications of mental health related issues. I think this is a really unique opportunity for state parks to really capitalize on this. Next slide, Phil. So just to throw that in there, and I've got pictures of my family recreating in state parks because I try and walk the talk in there. And so one of the things in there in terms of the research, the kind of the unique aspect of the natural setting, because you're not going to get many people talking about how physical activities are bad for you or health related programming is bad for you. So you're kind of in that space that other folks have got, you know, stuff going on. You've got Peloton ads, you've got other things going on in terms of exercise and physical activity and its benefit on health. So what's the unique aspect of state parks? And I think there's some really, really, really compelling research that's starting to show that the natural setting has some unique aspects that can really enhance that. So I think that's something for state parks to kind of really play out. And I've got some research in there from Catherine Ward Thompson, her group, in there that shows that folks wore those mobile EEG units and they took walks in urban settings and then more green settings. And basically, the green settings impacted the brain, that stimulated the parts of the brain that really helps with sort of a restorative effect, right, in there. So when you start thinking about that unique natural setting that many of you are managing, I think that's a unique space that many state park directors can play in. I think along those lines, the mental health benefits of park prescription related initiatives in there. I've got all of these references in there, but basically just to summarize, Nushan Razani, who's a pediatrician out in the West Coast, and Courtney for our toolkit interviewed her. She has a program called the SHINE program. She's shown that group park visits for some of the parents that she was working with, these low-income parents, reduced their stress quite dramatically in there. And then children who followed a park prescription in natural settings reported a significant improvement in their self-reported resilience in there. So I think there's some a compelling evidence base in there starting to be built upon the mental health benefits of this. You've got also the folks of, you know, the Washington folks talked about the prescription. So a lot of folks start talking about, why do we need an actual prescription? There's some really interesting evidence in there in terms of adherence, getting people to actually stick to a plan, right? You know, you've probably seen the research on diets and exercise regimes and that kind of thing, and how quickly people fall off the wagon in there. In terms of a prescription evidence adherence, if you've actually got something written down, similar to what the Washington state folks showed, adherence is increased. So people are more likely to follow through if something is written down and prescribed by a physician or a behavior health consultant or a healthcare provider more generally. The other things in terms of, you know, as state parks and state park directors think about this, particularly as you start engaging new types of users, structured programming, even though there is an additional cost, there's a lot of research out there that shows that structured programming is more likely to engage particularly newer users to start using your facility in there. So again, in our toolkit, we've seen examples from interviewing some of the state park superintendents and directors of some very, very interesting partnership. And I know, a shout out, I know Joe Schimmel's on this webinar right now, but they're doing some really interesting stuff in there that I'll come to afterwards. And then the one thing that I think, again, is an interesting space for a lot of state park directors to consider. Medical providers on the whole, and the research shows, they're very supportive of giving patients physical activity, like promoting physical activity amongst their patients, and also really encouraging this kind of preventative healthcare model. But they really lack confidence in giving patients advice. So there's some research that shows that less than 14% of primary care providers regularly counsel patients on exercise. And part of it is this confidence. In some work that Courtney and I have done, we found that they've got a fairly low level of knowledge of community physical activity resources out there. But if they are well aware of the resources that are out there, they're more likely to recommend it to their patients. And I think having that opportunity to engage and provide some knowledge for healthcare providers can really start moving the needle on some of these initiatives in there. Next slide. So we know about the challenges in there. The research shows that the biggest challenges are obviously transportation, particularly where a number of state parks are located. Knowledge of what state parks have to offer, and I think that's a real big opportunity. Again, Courtney, myself, and some faculty here at NC State were part of a wider project with the National Park Service, and there's some incredible stuff similar to state parks going on, but people are just very unaware of the opportunities, the programming, and some of the wonderful things going on within the parks that you manage in there. There's confidence as well, folks lacking confidence in going to a state park and knowing what to do. And that's often a challenge, as well as challenges of cost in there. Next slide. So just to kind of wrap this up and just move this over to Courtney, one of the things, Michelle Kondo from the Forest Service and a bunch of us, including myself, just did a systematic review of the park prescriptions programs and the research evidence based in there. And what we found is that there's a real growth and interest of programs that are morphing across the country. And actually internationally as well, but the evidence base isn't there. And a few people, I think, have asked about, engaging insurance companies, engaging kind of the CDC in there. And I think to kind of move this forward, we really need to develop an evidence base, a more robust evidence base, because as you know, insurance companies are not going to put money out there unless there's an evidence base to support some of the work that's being done in there. I think the app development space, and I know Courtney, who's going to be speaking afterwards, is really interested in doing some very interesting work in this area. One of the things that we found, and we found in the work that we did in rural North Carolina, that when you have a prescription, you can follow that up with prompts in there and feed it into an app, an integrated app. It can be very, very effective, particularly for the adherence. I think there's some really, really great opportunity for some unique partnerships. I think that to open up the range of opportunities that state parks are, the unique outlets. I've got a picture out there of a yoga retreat out there, and some partnerships between yoga studios and state parks has been often a win-win situation in there. And a couple of state park directors have talked about that in there as well. And then, again, opportunities for advocacy. If we can diversify who's using state parks or national parks or other types of parks, I think you've got more folks that are going to advocate for the services and the parks within their particular area. And I think there's some compelling evidence in there. John Crompton's written about this. Mike Bradley in Tennessee and Kentucky has shown through some of his work that there's some great opportunities to get some public support through people, a greater diversity of users being aware of those opportunities in there. And then I think there's an opportunity with health related programming in general to link to some other key political issues in there, conservation-based issues, climate change issues, as well as youth development based issues in there. So I think there's some really big, robust opportunities within there. So I think I may have gone over my 7 minutes. So hopefully that's just a quick brief summary in there. And I know there's a great opportunity for Courtney to expand upon this.
Thank you, Jason. And it's a good-looking family you got there, being outside. So we're gonna turn it over to Dr. Courtney Schultz, who will talk a little bit about the toolkit that Jason referred to. And sometimes I know that in the park world, I used to say, this is a lot of really interesting information, but it'd be nice if we could condense it down to where I had, this is what I need to do, and this is where I need to go look at. And if I had, like a template or a toolkit. So Courtney, I will turn it over to you, and you talk a little bit about the toolkit.
Thanks so much. So I think as we've already heard on the conversation and call this morning, there's a lot of movement around this idea of how to integrate what I call nature-based health programming. And I use a broader term than just something like park prescriptions, because what we're talking about is really getting our broad populations engaged in natural spaces. Those could be green spaces, they could be blue spaces, they might be red or brown spaces, depending on where you are geographically. But this idea of really reconnecting people to the natural environment, because we know from a far more robust body of evidence that there's health benefits that come out of that. There's a lot of evidence that we've seen coming out of South Korea and Japan around natural killer cells and how that actually helps reduce your risk of cancer. We've seen how these things can relate. And so sometimes if I'm a park professional working in state parks, it can be overwhelming to try to figure out how to integrate what seems to be really the medical field's sort of programming into what you do in the daily basis. And that's the myth that we really wanted to dispel with this particular toolkit. So really getting at the idea of what exists in the landscape, who's doing some really innovative things, who are some partners that can provide it, but also then having an action plan. So if we can go to the next slide. The whole idea behind this toolkit was to inspire state park leaders, state park personnel, to really be doing what I'm terming state park-based health programming. That idea of it being maybe in partnership with the medical community, but also something that can be self-prescribed by one of your clients, one of your constituents. So the idea behind this toolkit really is to design and provide state park agencies with ideas. There's no need to recreate the wheel. And as Jason talked about, there's a number of programs that exist out there. If you go to parkrx.org, there's roughly 80 to 100 just park prescription registered programs alone. And when we start to look at other styles of programming, there's thousands of different approaches across the US that have really successfully gathered authentically their communities in their local nature spaces to do this style of programming. So we wanted to bring that knowledge together to provide that inspiration, but to provide a guidebook of what these potential programs might look like, and really a series of exercises. And I think this is really what comes out of this most importantly, is how to customize it for your community, based on the needs of your community, based on what exists in terms of resources for your particular agency, and build something that is absolutely so authentic to who you are as an agency, who your constituents are, and really solving the local health crisis that's impacting your staff, your community, and this idea of what really hits home. So moving beyond things that are considered, national issues, and really getting back to the roots of communities, and really showcasing those diverse programmatic options. Maybe it is a plug and play program, something like working with ParkRx America, we're able to utilize that platform, but also going towards something that's a more bespoke model. Prescription Trails is a wonderful example of an idea that continues to be germinated across the United States, but always done in a very authentic manner so that it's always relating to the local parks, the local state parks, and the local needs of the communities. So let's go ahead and jump to that next slide then. So how does this work? That's a lot of information in 56 pages of a toolkit. Well, the toolkit is designed to allow you to jump between really 3 broad areas. One of the first areas that you can delve into if you're looking for kind of that template and that inspiration is to learn from your peers. So we conducted 10 interviews with a number of state park directors, development consultants, park superintendents to get a sense of really what's going on in the field. So we learned lessons about benefits as perceived by state park personnel for offering these health programs, looking at expanding options. How do you start to build this style of programming while still maintaining an authenticity to your mission as an agency? We talked to them about things like resource barriers, but moving beyond that, what those resource barrier solutions look like. This idea of bringing creativity back into this space so that we're not reliant just upon grant dollars or just upon hoping that insurance starts to reimburse us, but getting really creative about how to really utilize those resources at a local base. Talking about this idea of data. How are we measuring these programs? Jason alluded to the fact that there are so many programs out there, but the actual research around the impact of these programs is a bit worrying. Most of you are probably very familiar with the concept of the DARE program. For decades, we all agreed as a society, well, how could it be bad to, encourage youth to stay away from drugs? But the reality is there wasn't necessarily the science that went along with that, revolution to embed that programming in schools. And it turned out it really wasn't effective. And so we want to avoid that with this movement. We want to make sure that we are matching science with innovation to really be measuring the impacts so that you can continue to be incredibly good stewards of your limited resources and make sure that the programs that you are promoting are having that same impact that you are looking to have in your community in terms of health outcomes. And also looking at this idea of sustainability. It's great to get a movement going, but how do we continue to foster that, both in terms of part of the culture of the state park agency, but also in terms of making sure that as we continue to grow these programs, that they're not just reliant on the whims of the grant cycle and become something that become integrated with the actual culture of these state parks. So you can start there for inspiration to look at colleagues like Washington State who are doing some really innovative things and start to get a sense of how you can take the broader movement of nature-based physical activity, prescriptions and interventions, and really localize it to your particular state parks. The other part of this that we really looked at was making sure that we went through and learned lessons from health program partners. So we created profiles that would give you a real fast, in a 3-page report, a rundown of who these individuals are, how you can contact them for information if you're interested in partnering with them, but also getting the nitty-gritty, those things that you need to present to your director if you're going to make a pitch. Things like how the program actually operates. What's the program cost? How many staff am I going to need to dedicate to this if we're going to make this partnership work? And looking at things like how they collect data and how they're defining success. Because that's another important part of this, is really looking at this idea of maybe we rolled out a program, but how are we defining that program rollout as success? So learning from these different 9 health program partners, what they've been using as metrics to also help spur you to understand where the state of the science exists and some measures that might be very easily integrated into your own programming efforts as you continue to move this programming forward. And also getting back to that idea of creative approaches. What makes these 9 health partners different from one another? And what is their unique viewpoint that really might work best for your particular agency? And so when you've grappled with those, you might jump to them what is the action plan part of this toolkit. And that action plan walks you and your staff through a number of prompts and exercises in 4 areas. So if we can jump to the next slide, you can see here a sample of what those worksheets look like. And it's designed to really help you be reflective of where you are as an agency. So it's not just another mandate from someone in a position of power saying, we should jump on board with this bandwagon. It's a chance for you to really be introspective and figure out what it is you're trying to accomplish. What are those partnerships that you might need to cultivate, as we've heard from Washington. Those partnerships are so critical to the success and launch of these style of health-related programming. And what different skills are going to need to be brought to the table? How do we start to get at these dynamic solutions? And going back to that idea of the evidence, it's not just saying that we're collecting data because we need to be able to submit, certain benchmarks for the grants, but really making sure that, going back to that idea of stewardship, all of you on this call are here in terms of your stewardship of the land. But stewardship of the land also goes hand in hand with things of stewardship in terms of helping your constituents understand how to have a relationship with the land. And how do we start to bring all these intersections of things like conservation and things like health programming and things like maybe newer, diverse populations that we haven't welcomed into the spaces before in a way that really starts to integrate our whole communities back into state parks. And so that's really, in a very condensed nutshell, what the concept of this action toolkit really is about. It's about making sure that you have an opportunity to learn from the wisdom of your peers who have been doing phenomenal work, looking to those nationwide agencies who have really led this movement, but also giving you an opportunity to reflect and take all this information and, in a very short span of effort, distill it into 4 main areas that really allow you to make a decision on whether or not your agency is in that place where a plug-and-play program maybe is the most appropriate for you, and you'll reach out to one of those 9 health partners to facilitate a contract with them. Or maybe you find that a bespoke option is a little bit more agreeable. And so maybe you do reach out to someone like Prescription Trails Charm, who really is the leader of this movement in the United States, building on the Healthy Parks, Healthy People motion of working and looking at diabetics and creating those trails and being a huge advocate for ADA accessibility of our park landscapes. So there's a number of ways that we can start to, as Jason talked about, really tie this concept of health-related programming to a number of key political topics and concerns that are going on in the broader population. I think that's one of the things that is interesting about this particular line, is it's not just about addressing health. It opens an opportunity to be doing diversity and inclusion work. It opens the opportunity to be addressing things like climate change. What does it mean if these park landscapes start to change? And there isn't that same set of trees that maybe is giving off the phytoncides that are really promoting that killer cell promotion. There's so many different ways for us to begin researching this and looking at this. And I think that's where we have a great opportunity to bring both the research and the science of this into your efforts on the ground to make sure that we start ground sourcing what really could be an absolutely epic data pool, because we have had the thoughtful intention of embedding these sorts of metrics and definitions of success from the very beginning. So hopefully that gives you a sense of what this looks like. If you have any questions, please feel free to reach out. I'm happy to walk through this. This report will be, if not already, available online. So easily distributed, easy for you to work through with your staff, and a great opportunity to kind of wrestle with this at home.
Thank you so much, Courtney. Lots of information we've thrown at y'all today. And Lewis and I will work to, this webinar will be on, the video will be posted on the NASPD website, along with several links to some of the studies that we talked about today and some websites. A lot of folks are chiming in with some questions, and I think that's one of the interesting things that we get out of webinars, when you get a lot of collaborative folks talking and becoming innovative. And got a couple of questions that came up. One of them talked about the opportunity for innovation to develop a self-prescription option that could help with doing some monitoring of weight loss, blood pressure, blood sugar, those kind of things. And with everyone having wearables nowadays, there's certainly opportunities for innovation in our little world of parks to be able to talk about some self-prescriptions, and then find ways to incorporate that with the medical community. I think one of the fascinating things that I got out of listening today is that the need for nature and green space and blue space and those kind of things, that the medical community now sees the advantage of that. And the advantage for us in state parks is that we have those tangible resources that we're stewards of that can help make a difference. And we are the pharmacy, if you will, or the medicine cabinet for a lot of these issues that we struggle with as a nation with our health. And I think that's a really positive thing. Open it up for some questions for folks. And I know that some states are doing some real innovative things. I know the state of Tennessee has a very active program, as well as I think Georgia does as well. Lots of states do some stuff. So if you have any questions, you can unmute your microphone and we're going to take a few questions, and then we'll wrap up with some information from Louis Ledford about our next webinar. So if there's any state or anyone who would like to have a question for our participants or our panel today, now is the time. Any questions, comments? Is Tennessee on the line? Maybe not. Tennessee does a really good program, and I think there are like individual parks that do it in Tennessee as opposed to the entire system. But Tennessee does some good things, and again, our compliments to and appreciation to Washington for what they did. A lot of information to go through and to digest, and again, part of that is from Washington's standpoint is how you pull this off with getting the medical community and your local physicians engaged in this to be able to have a real active, sustainable program. And we look forward to being able to post some of the results from the research that North Carolina State has done with Dr. Baccaro and Jason, appreciate you being here. Dr. Schultz, Courtney, thank you for being here. And Louis, will make sure that we get that posted on our website and talk a little bit about the next webinar. And Louis, I'll ask you to talk a little bit about the next webinar and what we're going to be talking about and any other announcements that you may have.
Thank you, Phil. Again, thank you, and a big tip of the hat to you as well as all those that participated today. Courtney, really good summary, and we really want to give a big shout out to her for the good work she's been doing with Jason's work and supervision there at NC State. What a great opportunity. We will be putting those online very soon, and we're working to get printed copies sent out to the directors from each state as well. One other thing let me throw out there is a little bit of a tease. I don't have the details to share just yet, but we do have some funding from 2 different sources that we may be able to, a state that's never engaged themselves, so to speak, in terms of this health programming, nature programming network. We may have some funding that we'll be making available for some competitive grants. So we're looking forward to announcing those as well. But again, we'll get the toolkit up online soon, as well as the printed copies out to the parks. Our next webinar that we have under contract with Clemson, we're doing 6 a year, one every other month, will be next month, in March 30th rather. And Linda Lanneman, past president of NASPD and current president of the National Association of State Park, National Association of Outdoor Recreation Liaison Officers, will be leading a discussion about Land and Water Conservation Fund. That's arguably one of the most successful, one of the most beneficial legislations in terms of outdoor recreation and conservation in the history of our country. There's been some challenges. The authorization expired with a lot of work with a lot of people. We have that authorization put back in place in Congress, but now the big push and the really heavy lift is to fund that legislation and make it what it needs to be. So we look forward to Linda leading a group in a discussion on March the 30th for our next webinar. Linda, I don't know if you're online or have your mic unmuted. If you'd like to say anything, we'd welcome you to do so. Okay, maybe she's not, but again, thanks to all for the participation, and we look forward to talking to you again soon. And with this webinar, hopefully within the next few days, will be online that you can review afterwards. Thank you again, Phil.
Thank you. Thanks everyone for a very productive webinar, and we'll see you in March. Have a great week.